Hey guys, Josh Nimmo from CrossFit Metro East here. Here with Dr. Jordan Vickery today, and what we're talking about today is ankle mobility in the squat. And so you have that athlete that maybe gets down deep in the squat, their toes begin to flare out real bad, maybe their heel starts to raise up, and even get into a position to where toes out, heels raise up, and that knee caves in inside the ankle. So we all know, and if you don't by now, you better, that's just a poor position to be in when we squat. It's inefficient to move load, as well as puts the knee and the ankle joints, hip joints into a detrimental position for possible injury. So I got Dr. Jordan here today, and he's got just a few kind of go-to exercises to put at somebody if they can either do on their own, or as a coach can implement on somebody to get them in a better position when they squat. So Dr. Jordan, hit me.
First thing you want to know is, what's the tissue at hand? Where's the problem? Is it in the front? Is it in the back? Is it in the bones? Where's your issue that needs to be treated? Once you kind of get a grasp of that, or if you don't really know that, the best thing to do is start with a roller. Okay. So it's as simple as just getting on it, putting the leg straight on the roller, putting some pressure onto it. For more pressure, bridge up, and then go up and down until you find a really nasty, sticky spot. And then start rolling over it side to side.
Yeah, I really like the roll over back and forth.
What that's going to do is it's going to delaminate those muscle tissues. Those fibers get stuck together after they're used over and over and over, and rolling across it in a cross fiber is going to really pull those guys apart. Now, for the more intense people, you can always use a barbell for this. For the starting out, I would stick to a foam roller. Another way of doing that is just putting the foam roller on the backs of the knees and just sitting back on it and just kind of crushing into that. There you're going to stretch the anterior compartment as well as the calves. So another one. Oh, go ahead.
Oh, go ahead. So real quick on the roll, what kind of treatment time is somebody foam rolling on, or maybe how many reps are they doing on the foam roller there if they're doing the calves on the roll?
Go to your tolerance. Listen to your body. Your body will speak to you. Typically anywhere from 30 seconds to a minute.
Okay.
Now the stretch and holds, those are 2-minute holds.
2-minute holds. Okay.
This one is going to be a little bit more intense, so I wouldn't go quite a full 2 minutes on it.
Gotcha. Okay. What's next?
The next one is going to be a banded anterior stretch. So we're stretching in dorsiflexion. So if you're losing range of motion, your heel's coming up or whatnot, you need that range of motion where your toe comes back to you. So a really good one for that is just looping up a band, stepping into it, getting it right on the front of that ankle. You can get some decent pressure on it and then bend into it here, hitting different corners, whichever corner feels the tightest, preferably knee to the outside or straight in line with the toe. If you need a little bit extra, prop that foot up on a plate and go into it. The heavier the band, the more the pull into that back part. So this is really going to hit that anterior or that posterior heel cord very, very well. If you start to feel a pinch in the front of the ankle, it's okay. It needs to be stretched.
Okay. Anything else that you got for us on this?
That's a pretty good one to start with.
Okay.
Any pain that you can't knock out yourself in anywhere around a week to 2 weeks, you need to seek help with it. Don't play too much with something that's not responding.
Okay, great. Now, you said that stretch there, so that stretch is going to be a 2-minute hold, right?
That'll be a 2-minute hold.
Okay, and kind of just hitting the angle.
Hit the angles.
Perfect. All right, cool. Well, hey, guys, those are just a couple things. Like we said, so we said a little bit of foam rolling on the calf, possibly an anterior compartment stretch. Dr. Jordan had you where he's leaning back onto that ankle, and then that banded stretch, possibly adding in a little bit additional stretch with a plate propping that foot up. So a few things, just go-to ideas that you can hit if you're seeing those heels come up, toes flaring out in the squat, getting into that bad squat position. So let us know. Hit us back on some comments if you have anything additional that you want to talk about. Dr. Jordan's here twice a week with us. He's our movement and mobility specialist. So if you got other things going on, give us a call. We'll get you in touch with him. Thanks again.